But I don't know that I kind of expected it to be like your knee is broken or you've got to sprain your shoulder. And again, I'm coming from not a whole system wide interconnected network type of thinking. I'm thinking one item, fix it, right? Something broke, fix that broken thing. And then I'm sure the rest of it will come into place, right? But I think it's just naturally for me, and again, maybe it's other patients, maybe it's not. It was a whole different concept, and that challenge became this gap because I didn't really get what we were doing. Like I wasn't hand in hand with the practitioner as they were kind of doing their thing, and maybe it would help, and maybe it wouldn't. I don't know. It's probably a waste of time because you guys are trying to get the actual result going versus like sitting there and educating me for an hour on a recorded call. Like that's not really part of like everybody's assessment evaluation. But it was challenging for me to wrap my head around there. And now, like 10 years later, 13 years later, I can see there was value in, at least for my brain, the way I think. You mentioned something though and I'm curious, where do you start? I mean, there's a whole bunch of places you could look at. You probably do. Is there a standardized way that you look at that anatomy that physical therapists do, or the sort of specialized vestibular folks do? They start saying easy to hard, or critical, potentially central to not as much? Like, how do you guys start?
Yeah, easy to hard, I would say. There's a relatively standardized exam that we do to assess things like how your eyes move. Are they moving appropriately? Are they moving conjugately? Are they moving smoothly? Can you hold your eyes in certain positions, which you should be able to do? Can you jump your eyes between targets? Right. And so for some of the initial tests, we're looking for things that might be considered central or coming from the brain. And then we're moving to the inner ear system. And the main thing we're testing with that are the vestibulo-ocular reflex. If I move my head, do my eyes stay on a target if I want them to, no matter how fast I move my head? So if I hold my thumb up in front of my face and I move my head quickly side to side, I should be able to see my thumb clearly, no matter how fast I'm moving my head, if my vestibulo-ocular reflex is working. So we test to see whether that reflex is working or not. And then the other thing with the inner ear that we primarily are looking for is BPPV, which is benign paroxysmal positional vertigo, where little crystals that are called otoconia that are supposed to be in our inner ear on those gravity sensing organs that we talked about before, they fall off into the canals, those rotational sensing organs, and they cause a false sense of movement or vertigo when you change head positions with respect to gravity, right? Those are the primary conditions that affect the end organ or the peripheral system that we're looking for. After that, once we get into the central things, there are certainly central things that are urgent and scary that require immediate workup. And then there's central things that are more similar to vestibular migraine or 3PD that are chronic, kind of percolating for a long time, that I don't need to send you to the emergency room for, but I also can't say that it's coming from your inner ear. So to kind of break all that down and make it a little bit more simple, we're looking to see if the VOR works. And if it doesn't, then we're thinking that you have what's called a hypofunction, where one inner ear system doesn't work as well as the other one does. Yeah. Or we're looking to see if you have a positional vertigo, where when you change head positions, you get brief spinning episodes that are sort of reproducible by doing things like rolling over in bed, sitting up out of bed or laying down, bending your head forward, like picking something up off the floor, or tipping your head far back to look up at a shelf. Or we often hear, dentist chairs, or I was at the hairdresser and I was getting my hair washed and I sat up and the room started spinning.
Yeah.
So those are the two main peripheral things that we're looking